Good morning. Today we are going to discuss one of the very important change of condition in the skilled nursing home. And this is the time when you have a resident with elevated heart rate and you want to do a quick review and see what are the cause of the elevated heart rate, how you should proceed, how you're going to advance your assessment, and also make a telephone encounter to the physician who is supposed to get your report. We just learned first what is the normal heart rate, what can be the cause of elevated heart rate or tachycardia, and or technically what should be approached when we're dealing with the elevated heart rate. As you all know, the normal heart rate, which is very important for all of us to understand, is between 60 to 100 beats per minute. Technically, human should have a 60 to 100. You know, in the kids, that number should be higher, 110 to 150. After age of 6 years old, then we started to get a slow down on our heart rate. Then technically, for anybody, the elevated heart rate, it's going to be above 100, which we call tachycardia. However, there is some of the question is that if somebody has a baseline heart rate of like 55, and if that person is going to have heart rate of 90, that can be say is elevated heart rate. We can actually say that. Technically, if we have above of 50% of heart rates going to be elevated from the baseline, that also can consider to be elevated heart rate. For example, if somebody's heart rate is 60, the half of the 60 will be 30. Then if that person's heart rate will be 92, 93, we can consider that as elevated heart rate. Why do we get tachycardia? Overall, what is the reason that we get tachycardia? It's actually very good things that we get it. Is a compensation. It's a physiologic response. Means there is something wrong in our body. That's why our heart rate is going to be elevated. This is very important for you when you do an assessment, because then you know when you have elevated heart rate, there is a problem somewhere else, and that's why our heart start to increase the rate in order to compensate. One of the first things that you should always think about is about sepsis. It's a high possibility that your patient is septic and or having the infection somewhere, urine, stool, somewhere it's actually going on. This is another topic that we're going to call about SIRS, or the systemic inflammatory respiratory syndrome. But always looking for your sepsis handbook, always looking for your other vital signs. Should we check the blood pressure at the same time if it's going to be low? Should we check the respiratory rate, which is going to be fast? Should we check the oxygen rate that is going to maybe is going to be down? Always evaluate the patients all over from head to toe to make sure there's not any sign of sepsis. Like a sepsis can be sweating, can be disorientation, change of mental status. They have a chills, shivering, and they can have extreme pain, and they can have shortness of breath. They all can be sepsis symptoms that can just bring up this red flag that I'm dealing with a septic patient. The other part can be just the volume depletion. It can be because the patient has, again, loss of the fluid, like vomiting, diarrhea, or not eating and drinking enough. What we see is, again, our assessment. We're looking at the mouth, we're looking at the mucous membrane to see if it's dry, we look at the lips, we look at the eyes to see if there's a sunken eyeball that we see. We're also looking at the mental status. We're looking that the patient has weakness. We're looking at the thirst sensation, that the patient asking for water, asking to drink something. And we're also looking at the urine. Even the urine flow is very low, or if they have a urine, is a concentrated urine. These are the signs of the dehydration. And when it comes to the other things, it can be anemia, can be low hemoglobin, it can be bleeding somewhere. We have to always check to see if there's any bleeding. Do we have any hematuria? Has the patient has any diarrhea with blood, vomiting up the blood? These are the questions the CNA can tell you, and you think about when you're dealing with acute anemia. which we have a very, very different manifestation. They can be dizzy, lightheaded, fainting as a central point. Their eyes, their skin can be very cold and pale. We see the weakness. We see the change in the color stool, and we see the compensation ring, which is going to be tachycardia, and also chest pain and other stuff. They all can be symptoms of acute anemia. The most important thing is always go look at the lab, recent lab that you have. Do we have any drop in hemoglobin? And nobody addressed that. Nobody pay attention to that. That can be one of the things that we need to look for. The next thing is about hypoxia. Anytime when we have low oxygenation, it can increase the heart rate. This can be infection. The low oxygenation can be due to pneumonia. It's a bacterial pneumonia. It's a viral pneumonia. It's a COVID pneumonia. It's a flu pneumonia that we have the low oxygenation. Oxygen dropped to 70, 60, and as a consequence, we see the heart rate is going to be very high. We also look at for pulmonary embolism. Can it be blood clot in the lung that caused the low oxygenation? Yes, and that at the same time we have the tachycardia. What should we do at this point? We're looking at the entire picture, looking at the legs. Do we have any swollen legs? Do we have any red leg that thinks about DVT? In this situation, we think about possibly that the blood clot from the leg moved to the lung and cause pulmonary embolism. This is so important to know the hypoxia and tachycardia together. It's a very, very dangerous and very, very important a sign that you need to do an evaluation right away. Can it be due to heart attack? Is it cardiac ischemia? That's so important. Is the patient at the same time with hypoxia and elevated heart rate complain to you with shortness of breath and chest pain? Then you think about you have the heart attack. You need to do your assessment and send the patient appropriately to the acute care. But a lot of tachycardia can be due to pain. The baseline pain has been increased. Patient went to physical therapy and the pain is just go worse. And as a consequence, we have tachycardia. That's also very important. We always need to ask the patient, if the patient is alert and oriented, that is your pain is getting worse, or you see the patient objectively, you see the patient is moaning and is screaming with pain. The other things, it can be anxiety attack. A family members came and visit the patient and they have some argument and suddenly patients become extremely anxious, and as a consequence you get the report from the CNA that the patient heart rate is elevated. It can be anxiety. However, be very careful because you can actually make a false diagnosis. Always make sure the anxiety is at the bottom of your differential diagnosis and is not the cause of the elevated heart rate. Always rule out everything. Make sure there's no sepsis, there's no shortness of breath, there's no chest pain, there's no hypoxia, there's no blood anywhere, there's no dehydration or any other things that you can think. And put the anxiety at the bottom of your differential diagnosis. But yes, it can be one of the other causes. Exposure to stimulants. A lot of the residents, they smoke. They drink a lot of caffeine or caffeine in the drink. A lot of them, they may get illicit drugs, marijuana or any amphetamine. All of them can increase the heart rate. It is very important to objectively be explorer on the patient's bedside, ask some questions, look at what the family brought for the patient, look at the cans, look at the drinks that they brought. Do they bring any energy drinker? Did the patients get a lot of coffee today? It's so important. You are investigator and you ask the good questions at the right time. The next thing, it can be withdrawal of the medication. Especially like, for example, a doctor yesterday or today came, or nurse practitioner or physician assistant of the physician, and stopped some of the heart medication, especially beta blocker, which is a very, very important one. Sometimes abrupt from this medication can cause paradoxical tachycardia. And withdrawal symptoms can be like that. Patient is very irritable, patients maybe have trouble sleeping, restless, and tremors, and many other things. Or maybe the patient's been taking lorazepam and for a long time, and suddenly doctor came and they see that. And then tonight and tomorrow, we see the patient has elevated heart rate, very restless, very depressed, has a tremor. This is a sudden withdrawal of medication. One of the most important things, always remember, benzodiazepine, antidepressant medication, anti-anxiety medication, and pain medication. If you stop them suddenly, you will have withdrawal symptoms. And one of the signs of withdrawal symptoms is tachycardia. Now, what should we do? Should we panic, or we should do appropriate assessment and plan? This is what we're going to talk today. First of all, we need to understand, does tachycardia by itself have any symptoms? If, for example, if my heart rate is going to be elevated today for no reason, should I have any symptoms? No, really not. We don't have any direct symptoms. Always remember, if you see any symptoms with tachycardia, it's always associated symptoms. There's a fever, there's shortness of breath, and these are the most symptoms that you see, or hypoxia. Sometimes some patients feeling palpitation. They're going to come and say, I feel my heart rate is racing or increasing. And this is so important, because if for any reason we have elevated heart rate, we can have symptoms like chest pain, shortness of breath, and dizziness. Now, what should we do if we have a patient with elevated heart rate? Assessment, assessment, assessment. That's your principle. That's going to be your baseline that you need to do. First, you need to check other vital signs. Go and check the blood pressure, respiratory rate, temperature, O2 saturation. The physician over the phone will ask you about that. What are the other vital signs? How is the blood pressure? Why is that? Because if the patient has elevated heart rate and low blood pressure, that means we're dealing with sepsis. Okay? This is probably septic shock. If we have low oxygenation and palpitation and chest pain, then we're probably dealing with something in lung, maybe the blood clot in the lung. Maybe we have the pneumonia in the lung. That's a very differential diagnosis, because we can manage pneumonia in a skilled nursing home. For blood clot in the lung, yeah, we also can manage it. We just need to start anticoagulation, but we need diagnosis. That's why we need to send to the ER, do CT scan, and if the patient is positive, come back and we start the anticoagulation. Patient doesn't need to be admitted if it's stable. We always need to check for associated symptoms that I talked to you about it. Chest pain, shortness of breath. These are the two most important symptoms that you always think about, either is a heart or pulmonary. But if the patient has chills, patient is just having altered mental status, rigors, is probably we're talking about sepsis. But if you come to the bedside and you see, oh, this patient is so pale, it's very pale today. Mr. Smith or Mrs. Smith was not pale yesterday. That means they are losing blood, bleeding somewhere. Then be explorer, be investigator. Look at the urine, look at the stool, ask the CNA, has the patient has any blood in the stool or urine? Because that's exactly going to be a question the doctor will ask you. Has the patient had any vomiting up the blood or not? We need to look at it. If you look at the leg, always take the blanket out, look at the leg, see if there's any warmness, any swelling, any edema, unilateral, especially in the leg, which is sign of the DVT. Always ask about pain level. You can see this uncomfortable patients in the bed that is moaning and screaming so bad. Or you're just going to ask what's the pain level is. If it's getting worse, like for example today, patient had worsening of pain for no reason. Maybe there's a new fracture. That's why we need to find about it. This is all, tachycardia can lead you to a lot of things. Check the mental status. This patient is very confused. He or she was not like this yesterday. That's a change for the patient. And again, look at the anxiety attack. What we need to find from the chart prior to phone call is important. Always go to the recent lab. See if there's any changes happening to hemoglobin hematocrit from the last lab till the recent lab. Like for example, patient hemoglobin was 11.4, but like in the recent lab just drawn last Monday, it became 8.6. Interesting. 11.4 to 8.6. That's a drop. That means probably we are dealing with the acute anemia for some reason. Maybe bleeding somewhere that we're not aware of that. We're also looking at electrolyte. What is the potassium of the patient? Is it going higher or lower? Sodium and other electrolyte, but the main one, potassium, always look for it. Any medication has been changed. Sometime again, the doctor or the APP or physician assistant, nurse practitioner can come to the building, they change the medication and they go. Is there any medication has been changed? Especially look for the cardiac medication, blood pressure medication. Any antidepressant medication has been stopped or add. Any benzodiazepine medication, patients taking lorazepam, and suddenly the doctor came yesterday and DC all of it. Always look for them. This is so important. Any antidepressant medication has been discontinued. Prepare yourself for these questions from the doctor. The doctor will ask you first, is the patient stable or not? That's very important. Other vital signs can be very crucial right now, especially looking at the blood pressure. If it's very low with elevated heart rate, is the patient is going to be unstable very soon. Is the patient is comfortable or not? Is the patient is okay, just elevated heart rate, but doesn't have any other symptoms? Technically, how severe is the symptoms? Is the patient is worried about it? What is the families at the bedside that they are worried about? Oh, why the heart rate is very fast? Could you please call 911 quickly? See, that's kind of the reaction. You can say, we're doing the assessment, we're calling the doctor, and we're going to get the appropriate order for that. List all the associated or related symptoms related to elevated heart rate. As I told you, for example, doctor, patient has also elevated temperature. I noticed the patient's urine is extremely cloudy. I also got the report patient hasn't urinated. I look at the patient and I see the patient has extreme dry mucosa, very dry skin, looks very pale. Patient also have shortness of breath while I was being at the bedside. Feel very tired. I noticed that the patient is very confused. These are all the symptoms that you need to explain to the doctor. And again, prepare for your quick snapshot on the chart, looking at the recent lab. Doctor, I look at the labs. It seems yesterday labs, I look at them, everything is stable. Hemoglobin was 12.4, was 12.5 in the 2 days ago or last week. There's no change in the lab. Or I haven't looked at the chart. There's no medication has been changed by your practitioner. And what is your general assessment? That's a very important. Doctor, patient is stable. I look at the patient has some fever. I'm thinking about possibly some UTI because the urine also is cloudy. I can go ahead and do an IV insertion if you want me, and I can run the labs and see what should we do. This is a very important question because everything is about transfer versus not transfer. All depends on your assessment, how confident you are. Physicians rely on your competency, the quality of information that you provide for them, and severity of the symptoms. Many causes of the tachycardia is actually treatable in nursing home. Like if the patient is septic, we all need to do just an IV line, IV fluid, first dose of antibiotics, stat lab. Don't always remember, lab is not your priority. IV line, IV fluid is always your priority. And then if there is going to be any pain, we can adjust the pain medication. If the medication has been withdrawn by a physician, we can always restart at the low dose or the similar medication and then taper it down much slowly. If the hemoglobin is very low, but is not at the level of transfusion, maybe we can just start iron supplements in the facility, and then we monitor the hemoglobin very, very appropriately. If the anxiety, the doctor can help you with anxiety treatment. If there's a dehydration, we can do oral hydration, but very closely monitoring, or we can do IV fluid. We have all abilities to manage the patient. If the patient is COPD or pneumonia, we can do antibiotic, we can do nebulizer treatment. We don't need to transfer this patient to the hospital if the patient is stable. If the cardiac cause, like if patient has chest pain and severe shortness of breath, then the transfer is reasonable because it can be ischemic heart disease or pulmonary edema. The take-home point is tachycardia is most of the time is always secondary to other cause in the body, is a physiologic response. Always think about when I have tachycardia, there is something somewhere else is cooking. Assessment is the very most important part of your evaluation and the treatment. Always look for any associated symptom and sign, again, fever, shortness of breath, chills, dehydration, dry skin, dry mucosa, pale, all the things, pain, worsening pain, that's what we talk. And do not forget to look at the patient history, snapshot of the chart, and look at the recent lab or any medication that has been changed within the last days. Most of the cause can be treated in a skilled nursing home. The key is for the clinician to feel comfortable with your assessment and approaches. Do your initial workup at the skilled nursing home and to transfer patients only when the patient is unstable or the symptoms are worsening or possible cardiac origin. Thank you so much, and if you have any questions, please feel free to email me at my email at maadi@stanford.edu. And we're hoping if you have to review this, I'm happy to answer any questions that you have. Thank you so much.